no one else I would rather have than Jeff Manuel, who is, well, I can let him tell you his title, but Jeff and I have worked together for a little over 11 years, and he is not only a fantastic physician, a great clinician, and a wonderful palliator of people, including other healthcare providers. He's one of my best friends, and so I love him, and it's my great pleasure to have you do this. Welcome, Jeff, and you can tell I don't even know what your title is, but tell people your title if you feel like it, and you don't have to say where you work, I don't guess, if you don't want to.
Yeah. Well, thanks, Cody. And I just have to start by saying it's pretty humbling to be on this podcast with you. I count you as a friend, but I'm inspired by the work that you do. So thanks for doing that. And I'll say it's a little intimidating to be in the presence of you on this podcast. So anyway, a little bit about my background. I'm a family physician by training and a hospice and palliative medicine physician as well. I'm the service line medical director of our department, and I am a fellowship program director and have directed and taught fellows in palliative medicine. And I feel just super blessed to even be in this position as a physician, to be able to share in some of the most challenging, intimate, special moments of a person's life, and to be able to try to help make that time just a little bit more tolerable and easy, and to help relieve any suffering that people are experiencing. So when Cody asked me to talk about one of the patients that really kind of impacted me, and thinking back earlier in my career to a young woman. I'll call her Megan. Megan was 27, and we got this referral to ask to help her with pain. She'd just been diagnosed with metastatic uterine cancer. And my first thought whenever I see someone in their 20s with metastatic disease that I know will be life-limiting, it definitely it gives me pause. I think at the time I was probably 30, so not much different in age to her. And it just, it's hard not to have your humanness kind of come out in those moments. So I do what I always do. I took my emotional temperature when I'm in the room, and said, okay, I need to be ready for this. When I got in the room, Megan was kind of laying flat in the bed, just kind of staring at the wall. You could tell she was in significant pain. And her mom was sitting in the corner. And as soon as I walked in, she immediately said, "Hey, doctor." And you could tell just her desperation and wanting to get some help for her daughter. I think they had just gotten the diagnosis of metastatic cancer that day. And so just feeling the weight of that diagnosis and seeing the pain on her face. And in reviewing the chart, she had some pretty significant disease in her spine and in her shoulder that was causing very severe pain. And so I knew there was both physical pain, but as we know with pain, when you have faced with the terminal diagnosis, that makes the pain that much worse. And so I spent some time talking with Megan. She never made eye contact, just kind of looked off. How are you doing? I'm okay. Okay, how's your pain? I'm fine. And her mom would interject and say, she's hurting, please help her. And Megan just kind of almost wasn't there. And most of the time, either staring off into space, but a lot of times just kind of eyes down, very quiet, very reserved young woman. And so I talked to her about her pain, talked about our plan. We put her on a pain pump or PCA to give herself some pain medicine, and said, "I will be here and we will get you to help you feel better." There wasn't a lot of other interaction. She clearly didn't have a lot she wanted to talk about. And my job right then was to try to get her comfortable. So over the next day when I walked in, Megan had barely pushed the button, still not moving in bed, not wanting to, I think she didn't, I wasn't sure why that was. There can be lots of reasons why people don't use pain medicine. Sometimes it's a fear of addiction. Sometimes it's feeling like they deserve to suffer. It can be a lot of different things. And so I started to ask her a little bit more, and told her, we can get you to feel, we can help you feel better. I can see that you're in pain. And she kind of did the look up in my eye for just a second, and then looked down and said, "Okay, I think we can maybe make some progress." So I really encouraged her, please use the button, because this will help me know how much pain medicine you need. The next day, she had used a lot more. And you could tell, though she still didn't make eye contact very much, it was still really reserved. She was starting to relax a little bit in the bed. And her mom immediately came up and grabbed my hand. Thank you, doctor. You're amazing. I was like, no, I just gave some morphine. It's okay. But but you could see that she was starting to relax and soften and get a little bit more comfortable. Um, Towards the end of her hospital stay, she was there for a couple of weeks. It took a long time to get her good pain control. We increased her opioid medications. She got radiation treatment. And I said, I want to be here to support you both physically, like we have been, but there's a lot that I'm sure is going through your mind, and we want to make sure that we can continue to support you ongoing through your cancer diagnosis, because there could be a lot going on. She really didn't open up then too. I wish I could say I had the magic words and she opened up herself. But I said, I want to see you in clinic in a couple of weeks. And so we set up a follow-up appointment, and I was there with my social worker. And the two of us, when we saw Megan, she was kind of came into the office all dressed in black, again, not making much eye contact, really quiet. And her mom did most of the talking. And I think towards the end, I can't even remember exactly what was said, but our social worker said something that I think kind of really resonated with, we want to help you to live as well as you can and not be focused on what this cancer means for you, but how do we help you live with this cancer? And you could see she kind of raised her eyes up a little bit and started looking at our social worker. And she said, I want to see you back in a couple weeks. And so they met, and they would meet probably every 3 or 4 weeks. And as I would talk to our social worker, I guess I should say her pain got a lot better with radiation. We were actually able to wean her back off her opioids, and she was feeling much better. And as our social worker would talk to me about Megan, she would say, man, she has been so anxious and almost agoraphobic to the point in her life where she was not getting out. She was just staying in her room. She was a gamer. She would play online games, but really didn't have much community, many friends, and had almost kind of isolated herself. And this was before her cancer diagnosis. So she had had some trauma in her life and some other things that had made her just feel really, really, really small. So when I would see her, and I think her not wanting to make eye contact wasn't just fear of her cancer diagnosis or fear of the pain. It was just fear and anxiety that she had been living with. So I saw her, I think, in follow up. I think it was like 3 or 4 months later. And I was amazed at what I saw. Megan greeted me with a smile, and she started talking and telling me about herself and her experience and all the things that she had been doing. And something about her work with our social worker and the work that they had done together had her totally re-examine her life, face her fears, and be able to engage in a way that she had not been. I think she was suffering from both depression and debilitating anxiety, and we helped her with some medication, but I think just having someone to talk it through with her made a huge difference. We did not talk about her cancer almost at all. We talked about the board games she loves to play. I love to play board games too, Settlers of Catan and Dungeons and Dragons and other things. And she had started a gamer group that came over to her house while she's getting chemotherapy, while she's getting treatment. And I was just amazed at the transformation that happened in her life. And it was because she was able to connect with us, and cancer wasn't the center, but cancer was what brought her to this space. And over the next 3 or 4 years, she would have these new cancer tumors pop up in different bones, and she would have horrible, horrible pain. We'd work to get her more comfortable, get her some radiation treatment, and then she'd wean off her opioids. And we'd almost start calling it a game. It's time to get them back again. And then we'd work our way back down. And she almost, I think towards the end, would give me a hug when she would see me, which is not the Megan that I had met, not the person that I had seen. And then her cancer continued to progress through different chemotherapies. And she started thinking about the legacy that she wanted to share with her friends and the new friends that she'd made. And she never had it I mean, I guess if I were in her position and I had found a new way to be in this world that was much more who I was, much more comfortable in my skin, I think I would worry about what did I miss out on? Why did I wait till the last 3 years of my life to figure this out? She never brought that up. It was always full of gratitude and how do I actually really truly live as good as I can with this cancer diagnosis? She had a ton of books and she was trying to figure out how she could donate them to libraries or to schools or to other places and was just wanting to share that joy that she had with other people. I had a chance to see Megan, I think, in the last week of her life
Mm.
in the hospital. She had developed a pneumonia and the cancer was in her lungs. And we had tried antibiotics and we're just not able to make it. And, you know, when I saw her, she was in significant like delirium and just kind of in and out of it. But the one moment she just looked at me and she goes, you know, thank you, Dr. Manuel. You gave me a chance to live. And I really appreciate that. And then she died a couple of days later. And I don't know, I've had different people have their bucket lists or say there's certain things that I want to try to accomplish when I'm facing this serious illness. But there was something about her experience of taking this horrible, awful moment that nobody would wish on anyone at 20, 27, 28 years old. And dying at 30, and yet really figuring, just having that, seeing that as a catalyst to really open up herself to being comfortable in her skin. I think she even said that at one point. She'd gone through life not comfortable in her skin, not comfortable with who she was, and she left this world feeling comfortable with who she was.
Yeah, geez. Just so much is going through my head as I'm listening to that story. I guess first of all, we work together, so I mean, I know we do this, right? But would you talk a little bit about how you prepare yourself to go in and see somebody?
Mm-hmm.
I mean, I know you said you take your emotional temperature, which you know we've talked about a lot, and but you know what goes through your mind as you're about to go into a room like that?
Yeah. Yeah. I mean, I think this was something I learned early on in my training and was kind of a way that's really helped me be truly fully present with the person that's in there. I think when I say check my emotional temperature, I'm really trying to understand what are my own human emotional reactions that are coming when I am walking into the room. Am I feeling anxious about this for any particular reason? Am I feeling really sad because this patient reminds me of a loved one, or I'm just, you know, upset or angry or whatever the emotions are. I don't try to guess what they are. I just try to see what am I feeling. And are there any kind of assumptions or biases that I'm bringing into the room? I think when I'd heard about Megan, I'd heard that she was a very withdrawn person, kind of short with people. And, you know, it's easy to kind of make up a story when I go
Yeah,
into the room. And so I almost also want to check out what is the story that's in my head right now. And I want to be surprised, or I want to be, I'm preparing myself to have it be different. And so
yeah,
I think all of those things, and I do that for a couple reasons. First of all, it's really hard to be with somebody and all of a sudden have an emotional wave of sadness creep into you when you're in the middle of the room. Sometimes that still happens, but knowing where that's coming from and being ready for that, I think helps me keep my professionalism and be present for the person rather than letting my own emotions get in the way. And then I think it also just allows me to be yeah, just to be aware of what I'm feeling when I go in. So
yeah.
that's what I do with younger people. I think there's just a level of sadness that a lot of the staff have, and so I am just aware that I'm carrying that, and I also I've had patients tell me that they're happier, they're more okay with the diagnosis than their doctors are, and
Yeah.
so I really don't want to be that guy that
Yeah.
that
Yeah.
is more upset than they are. So
Yeah,
I just want
totally.
to be just ready for whatever
Yeah.
I get.
Yeah, I have seen that. I mean, I've seen it very clearly when, you know, when I'm in talking with somebody, and I could talk a little bit about my experience of going into those rooms, but when I'm in talking to somebody and like one of the other physicians or one of the residents will come in, we're having a great conversation and everything's fine. And then that person comes in, they're super, very solemn. Everything is very serious.
Yes.
And then they leave and we're like, what was that? Like, what, what's wrong with them?
Right.
But I think that was really, it's a really important point that we all carry biases and assumptions, and there's always a story going on in our minds about what's happening. And so often with healthcare providers, with everybody in the hospitals, all staff, there's often this story, this narrative that is about the patient, whoever the patient is, especially if it's somebody young or somebody very sick or somebody that is about to find out that they're, whatever it is, somebody that's difficult. And like you, I often will take that narrative and go, okay, I want that to be proved wrong, right? Whatever that is, I'm looking for anything that is other than what I've already been told. And I think that helps me to be open to whatever comes. And sometimes, they prove everybody right. The difficult patient really is kind of an asshole, and that's okay. Like it's fine if that really is the truth. But yeah, I really appreciate that. All right. So the whole point of this particular iteration of Dying to Tell You is to talk about a story, but like how that story has changed either how you live your life or how you practice as a physician, or any other thing. So what did you learn from that interaction experience?
Yeah. So I might answer both those questions, but I think how I practice as a physician, I think with Megan, I really felt like I had a sense of who she was and what her story was going to be after the first few interactions. And I think I always try to go in without a bias, but I also am trained as a doctor who often puts people into boxes and has kind of ideas. And I think it really allowed me to open up and say, my job is, what I thought the task was for her was to just help her with her pain, help her feel okay with where things are, and know that she's just a shy, quiet person, and that's okay. And we don't need to do much more there. And for her to completely transform, I'd seen people who have done reflection and kind of felt at peace and been able to kind of really make the most of their last bit, but that transformative power of this really tough diagnosis, I think I'd not seen before, and I didn't think I'd even given space for that. And so I think going forward, it's like, man, anything can be possible, and actually, it is even more important for us to give people that space to make of it what they will, and not like make assumptions or do something. And I credit our social worker who was significantly kind of invested in this patient and in Megan, and in trying to, she saw something and saw an opportunity. And I think that's great. So I think for me personally, sorry to cut you off, but I think for me personally, I would say, I think I've lived my life in my head thinking that really tough situations can bring about really positive change or whatever, but I don't know that I really believed it until I met Megan. And so I think this idea that fully embracing the really challenging moments and saying, what can I learn from this? That's hard. I'm still not that good at it, but I think seeing her inspired me to say, okay, it's never the last part of the story. So,
well, you say you're not good at it, but I'm going to say that you're wrong about that. I've seen in the years that we worked together, you've encountered lots of difficulties, and I think that you do a really nice job of taking whatever's given to you and making the most of it, or even growing from it. I think I've seen you grow as a person through lots of difficult things. So I disagree respectfully.
Well, maybe I can credit Megan for helping me
There you go.
to think through
That's
that.
nice.
So
Yeah. Cool. Well, do you have anything else you want to say about it?
No, I just, again, really appreciate you having me on and sharing my story. So
thanks for doing it. You're encountering a lot of difficult situations, and I think it's important for people who are engaging in the healthcare or in receiving healthcare to kind of understand that other side. Cool. All right. Well, thanks for doing it. And I love you. Bye.
Yep. Love you too.
Thanks, Jeff, for joining me on the podcast. And on a personal note, thank you for leading our team and teaching me so much over the years as we've done this palliative care work together. And thank you most of all for being a true friend, for your unconditional acceptance of who I am, and support in my hope to be better each day. Love you, Dave. Thank you all for listening to the podcast. Be sure to check out Jeff's nonprofit, Health Ed Connect, at healthedconnect.org. Follow us on all the social media and subscribe on your favorite podcast platform so you don't miss any of these great stories. This is Dying to Tell You, The Caring Perspective.